Hello and good morning. I'd like to provide an update on the COVID vaccination distribution efforts in Lucas County. Phase 1B, those who are 80 years and older, started this week. Approximately 19,956 individuals, or about 4.66% of Lucas County's population, has been vaccinated to date, whereas about 4.1% of the state population. So we are trending above the state average, which is great. Just a friendly reminder for those who have pre-registered for email notifications. These are sent out based upon your age and eligibility, therefore allowing scheduling for those who may fall into that phase. These emails may be going directly to your spam or junk folder, so please make sure that you're checking those. If you have signed up, you should have an email in your folder as we sent vaccine correspondence this morning. Individuals who are able to schedule their vaccination appointments at the local hospitals through the Lucas County Health Department website. Other vaccination providers can be found on the Health Department website as well and can schedule at those respective locations calling the number listed, as you see on the screen. What we'd like to do today too is actually walk through the website and how you get to actually getting to your vaccination appointment through the links. I think Shannon Lands can go ahead and handle this. So Shannon, could you please walk through the website for us?
Sure, thank you, Eric. As you will see on your screen, the Lucas County Health Department's homepage is live on the screen. It's lucascountyhealth.com. And as soon as the page populates, you'll see right in the middle where there is the COVID-19 vaccine vial, a green button where you are able to click to view the vaccine schedule. It takes you to the vaccine info homepage, and that first bar that's green and then will turn blue when you hover over it is exactly where you need to go to schedule appointments. Now, this talks about the eligibility, the timeline, some information about your appointment, making sure you're bringing the correct identification, driver's license, insurance card, etc. Talking a little bit more about appointment information, how they can be canceled or rescheduled. However, if at any point in time you are having an issue with scheduling, there are supportive agencies that are there to help. We have United Way 211, and then also the Area Office on Aging that are able to assist individuals in scheduling appointments. As you scroll down, there's also an interactive map that allows you to type in the location from where you live or where you would like to go to have your vaccine, and it will pop up. You can type up in the left-hand corner where there's that green or blue bar, your address, and then it will show you the closest locations of the providers, whether it's Kroger Pharmacy or University of Toledo Medical Center or another hospital. Right now, we just have a handful of providers online, including all our hospitals in the area, Kroger, and then the FQHC, Federally Qualified Health Center of Health Partners of Western Ohio, that are providing vaccines at this point in time. As you can see, if you hover over one of the hospitals, it will provide the name, how to schedule an appointment, where it says more info, the actual location. If you click on the more info to schedule an appointment, and this is true for all of the different locations, this other page will pop up. And it's a lot of the same information that you saw initially on the page that you had transitioned to from the home page. So if you scroll down, it will ask what day and time, and this particular location only has one day available, so that's Monday, January 25th. I think it's from 8 a.m. to 4 and scheduling every 10 minutes. So you find a time that's most convenient for you, you click on that, and then it will start to ask your information to register for the appointments. If you are a caregiver or a child or registering for someone else, please put the recipient's name in there, their first and last name. You can certainly put your phone number or your email, but the individual who's actually receiving the vaccination, make sure you have their first and last name and then their demographic information below. Also, please note that if this individual or yourself is getting a vaccine on this day, they also need to be available for their second dose, which may be 21 days or 28 days later, depending on what type of vaccine you're receiving, whether it's the Moderna or the Pfizer. They're also going to ask if you are free from COVID-like symptoms and certifying that you're 18 years of age and older. And then as you scroll down, like I had mentioned, a lot of demographic information that we're asking. Social Security is not a requirement on this page. You certainly can put that in. If you don't feel comfortable, that's not a problem. I will let you know that you will be asked your Social Security number on site when you are registering and checking in for the vaccine. But the rest of the page just continues on asking your information, what county you work in. If you are retired but worked in Lucas County, you certainly can still get the vaccination here in Lucas County. And then also your primary language, and then what population you qualify under, and that is a requirement. There's 3 different options. Those who are 65 and older, which would be 75 and older for this specific week. Click that, and then the submit button, and complete your appointment. And you will receive a text message and an email notification or confirmation of your appointment, where it is, what time, where you need to go, etc. So let's go. Okay. As you can see below the interactive map, if you choose not to utilize that, we also have listed out all of the county hospitals by name. If you hover over, you will see that it changes colors. It's actually hyperlinked. All you have to do is click on the title of the hospital, and it'll take you back to the same appointment form that we were just walking through. Additionally, the highlighted text or the bolded text below is the actual location where each of those hospitals is providing their vaccination. So St. Vincent Mercy Medical Center is doing their vaccines in the medical office building number 2, utilizing entrance C. Toledo Hospital is doing theirs in the education room A, so on and so forth. In the event you don't want to use one of the hospital providers, you certainly are more than welcome to reach out to the Kroger pharmacies. All of the participating providers' addresses are listed below. You can click on the hyperlink for more information, or you can reach directly out to them at the 866 number listed there. And right below that is the scheduling link for Kroger that will walk you through the process as well. And then lastly, right below that is Health Partners of Western Ohio, where they do ask that you call to schedule an appointment. And once an appointment is scheduled, they will provide the location information on where you are to go to get your vaccination. Eric, I'm going to toss it back over to you. Thank you.
Thank you, Shannon. Just want to let you know that we revamped the website a little bit from last week, and hopefully we'll be able to again make it a little bit more user friendly for you. I am very happy to say that over 4,000 80-plus-year-olds were able to get on the website, or at least have somebody get on that website to be able to then schedule their vaccination appointment. So we hope that again we tweaked it enough this week to even make it more user friendly. So as we go through this next week, we'll listen to the comments and feedback and make sure that, again, we make it even more user-friendly if needed. For those of you who may need assistance scheduling, the Area Office on Aging and United Way 211 are available to help with this. Also then too, the Toledo-Lucas County Public Library is offering the use of their computers to anyone who is in need. Please make sure that you know the time that they're open. I understand it too that the libraries have extended their hours of operation, so that's great. But please, if you're having issues with getting on a computer, please utilize that partner. I do want to just talk real quick about partners. Again, the community is phenomenal. We not only have those partners at the hospital level who have worked tirelessly to, again, fit into a system that was really thrown upon us very quickly. But these other partners that we have, United Way 201 has been instrumental in helping us make sure that, again, we can answer those questions. And really, Area Office on Aging, we don't think of them enough, but they have went above and beyond trying to, again, quickly establish a system to help our elderly out there get these vaccinations. So again, thank you to everyone out there. Next week's phase 1B eligible groups include individuals who are 75 years and older, those with developmental and or intellectual disabilities, and please, this is important, and have a severe congenital, inherited, or early onset medical disorder. You do see them on the screen. Please visit our website too to understand who is eligible for a vaccine in this category. I do want to state that we as the health department are working closely with the Lucas County Board of Developmental Disabilities to ensure all these eligible individuals in Lucas County are able to receive the COVID vaccine. With that, I'd like to introduce Lori Mariucci, who is the superintendent of Lucas County Board of Developmental Disabilities. And I think she has some comments and maybe some offering some direction for us. So Lori, please.
Hi, thank you very much. And I would like to take a minute and thank the health department, the Lucas County Health Department, and the ProMedica Health System for their leadership in helping us with phase 1B. I'd also like to give a special thanks to Governor DeWine and Jeff Davis, who's the director of the Department of Developmental Disabilities, for their leadership as well. We serve a very, very vulnerable population in Lucas County, and what we are doing is we are contacting individuals served or guardians, and we have, I'll say SSA, which is our Service and Support Administration Department. They're contacting over 1,000 people so we can get people scheduled with the ProMedica Health System within the next 2 weeks. I'd also like to just mention that it's critical, and Dr. Z alluded to it. We have right now with phase 1B, it's individuals who have a developmental disability and one of the high-risk medical conditions. I would also like to just add briefly that if you think you're eligible and we haven't reached out to you or your number has changed, I'd like to say, please contact Margaret Dramzik. Her phone number is 419-380-5117. You can call anytime, day or night. Margaret will help with registration and get you to the right department, or do the registration herself to get this done. It's very important that we get the shots in arms at this point. It's critical. So thank you again, Dr. Z and your team.
Lori, thank you so much. And it is a pleasure working with you. And we will get through this together, you and all of our other partners. Again, thank you to all of them. Also, again, we're here to make sure that we forecast in the future and make sure the community understands what's going to happen as soon as we know. And you might have heard the governor talk about this, but during the week of February 15th, residents with any of those listed conditions and do not have a developmental or intellectual disability will then be eligible to receive the vaccination. So again, please stay tuned. Again, we want to make sure that we're getting this information out now so that we can also then prep the community as well as us here internally to make sure that we're prepared to make sure that we roll this out at that point in time. Please understand, supply is still very limited of the vaccine, and it's going to be for a while. And appointments are limited, and they are subject to change. So please make sure that, again, you just bear with us. We're working as hard as we can with all of our providers and all of our partners to make sure that we get the schedule up, we get them scheduled quickly, and we get shots in arms. And that's the most important thing right now. Every shot in an arm is a win for Lucas County. It's a win for Ohio. It's a win for the United States. So please just bear with us. I want to talk again about scamming. We hear about this all the time. Matter of fact, there was some conversation this morning on the internet about scams related to COVID vaccinations. This is continuing to happen. And I want to remind you, we will never call you back and ask for personal information, Social Security, birthday. We're not going to do that. And as you heard Shannon earlier about Social Security numbers, again, you don't have to provide that. You can provide that at the site. So please, let's make sure that we protect our personal information the best that we can in this day and age, and understand that there are scams out there. So please make sure that, again, you pay attention to these comments about scamming, and just please be careful. I think too, again, I think we need to discuss our current condition as well too. We still need to wear face coverings. We still need to social distance. We still need to, again, avoid crowds as much as possible and wash our hands. So those things are still very important, and we have to continue to do this. as we're getting vaccinations, it's going to help us knock down the amount of COVID in our community. But again, with limited supplies, we still have to have other strategies, such as the ones we just talked about, the ones we've been using for so long, to make sure that we continue to knock down and keep COVID at bay. I do believe that's all the comments for today. I'd like to open up for questions.
Amy Steigerwall with WTOL has a question. Amy, go ahead and ask your question.
Hi, Eric. So Shannon walked us through those steps, which obviously were helpful and very visual for us, but I had some people who did exactly that yesterday. I walked them through those steps ultimately, same website, same protocol, and they were getting a result saying there's no appointments available, even though it kind of says, you know, there's one at 8:30 or whatever. Is that something you guys are hearing? And I guess, are those appointments available? What should they do if they get that message?
So are you saying that there was an appointment available, a slot available, but we could not get them into that slot? Is that correct?
Yeah, they're getting a message saying, you know, that one, say it's like 8:30 and it's listed on there. They're clicking on it, they're putting in their information, but they're getting a result saying no appointments available for a month or so.
Okay, can I just let me ask one question. What time did you actually do that for them?
It was just around this time yesterday, and it was for appointments later in January.
We're gonna go ahead and look into that. I do know that all 4,050 have been booked, but of course, like I said, you know, we have to remove some people sometimes, and those do open up. So let me look at that and find out what actually is taking place. We'll fix that if there's an issue.
Okay, and then on a kind of somewhat different topic,
Sure.
We've been getting a lot of questions that we've been clarifying, but maybe you can kind of shed some more light on this. People who, you know, say they're 63, you know, they're obviously not in this first phase, but they have, you know, some sort of heart condition, or they have diabetes or something along those lines. And, you know, why is it just kind of based on oldest to youngest at this point? Is it just because, you know, the state just possibly can't keep track of everyone with all of those conditions? I guess, you know, what is your take on that?
Right. So again, we're looking at the most vulnerable populations, and I think the governor has stated that several times, as well as ODH. So it goes back to, if you look at fatalities and who have the most issues with COVID, it really are those 80 years and older, those 75s. And so again, with a limited supply, you have to make some decisions on that data. If we had unlimited supply or even double that, then you know, I don't think that would be an issue. But again, until the faucet opens up with more vaccines, we're going to have to continue to abide by what the governor is asking. Does that help?
Yes, thank you.
Right. My staff just walked in, and they're, because these, we'll go back to the original question you had, I'm sorry. You know, these things fill up so fast that even sometimes when you click on it, you start filling it out. By the time you finish the form, somebody else has already filled out the form and clicked to say, I want that appointment. So that could be one of the issues, but we'll dive in further as well to make sure that that is not, there's not another concern or another glitch in the system.
Okay, Melissa Veitch with Channel 13, please go ahead and ask your question.
Morning. Couple questions here. First, a lot of people have said that when they ask about the availability of the second shot, that they have not been assured that there's going to be a second shot. What do we know about how that is going to play out? A lot of people are worried they'll get their first shot, and then when it comes time for their second shot, there won't be enough vaccine. That's the first question.
Melissa, thank you. That's a great question for the community. This is what I know. I and other health commissioners have a weekly meeting with the governor. We meet multiple times in different settings with the Ohio Department of Health. And each time that we as health commissioners or other individuals ask that same question to those leaders, they are assuring us that that second dose is available. Matter of fact, we received our original dose of 2,700 several weeks ago. We received our second dose last week of 2,700. So we are seeing it come into our facility. So we know that that second dose is available. So as of today, there is no issue with a second dose coming from leadership.
Okay, thank you. And then again, I know you touched on it, but it's become very confusing for our viewers at certain times. The issue of intellectual, developmental, congenital disabilities.
Yes.
Those folks sign up now with the 75-year-olds, and then on February 15th for that week is when we have people who may have the congenital issues, but no intellectual delays. It just gets very confusing for folks.
Yeah. Oh, okay. So let's peel this a little bit. So those individuals that have intellectual development disabilities, as well as those other medical conditions, they are going to be eligible for next week's vaccination. You heard from Lori that, again, they're contacting those individuals. It should be a small percentage of our community that may not have been reached out to, or they think there might be. So those individuals, again, need to work with Lori and her group there. The second portion of that, I do believe, is the February 15th date. Again, we want to make sure that gets out as soon as we can. And so we wanted to talk about that today. So as we're understanding at this point in time, again, this is what's being explained to us. If those individuals that have those conditions then will be able to sign up that week of the February 15th for their vaccination. So again, want to make sure that we got this out early. There could be little pivots here and there. So please stay tuned, but this is what we know as of today.
All right, thank you very much.
Good.
Bree Malaska with WNWO Channel 24. Please go ahead and ask your question.
Hi, Eric. How are you?
Good. How about you?
Good. Thanks for taking our questions. I just wanted to kind of see where we are right now in the county, how many doses have been given out, how many appointments have been completed, how many appointments are available.
Okay, so let's talk about what's happened this week. 99% of those scheduled vaccine appointments for this week have been taken. Now, I can't say 100% because, again, some people will go ahead and say they can't make it today, and so they remove themselves from the list. So, again, over 4,000 individuals will be vaccinated by Saturday, over 4,000 individuals. So we are well on our way to doing what we've been asked to do, is making sure that the 80-year-old and older group is vaccinated. Please remember, if you are 80-year-old and older and you did not receive your vaccine this week, you could still sign up for weeks to come, okay? It doesn't mean that you're not going to be able to sign up. So again, please, we're doing this in stepwise fashion as the governor has asked us to do, and that's how we take our direction. And we'll make sure that this is as painless as possible, the procedure to actually get to the site to get your vaccine.
Sorry, so you said over 4,000 will be vaccinated by Saturday. All the appointments are almost filled for this week. What about for next week? Do you know that?
Okay, those are up on our website, and again, for that group of 75 and older, please go ahead and start getting your schedule done. I will let you know this. I know that we had some traffic issues last week when we rolled this out. We had over 22,000 hits on the website at that point in time. So we've worked with our internet provider, and they've assured us that they've opened up that bandwidth. So hopefully we don't have the issues we had last week. If we do, we'll make sure that we fix it.
Great, thank you so much.
Sure, thank you.
Are there any other questions from our media friends? Oh, Brian Duggar, go ahead and ask your question.
Hi, Eric. We're hearing some reports around the country of some clinics where people aren't showing up to their appointments. Has this been an issue at all in Lucas County? And do the providers have a fallback plan so no vaccines are spoiled?
Right, great question. Yeah, we've had individuals who have not showed up for their vaccine appointment. Again, I can't give you an exact number, but again, it's not a real concern. The real concern is when they don't show up is that wasted dose. We cannot waste doses. Not at this point in time. It's too limited. It's too precious. We need to get these in those vulnerable populations. So if you're going to sign up, please make sure you make every intent and effort to get to your appointment. And if you know that you're not going to be able to get to that appointment, cancel it as soon as you can, please, because somebody else is waiting. let's talk about waste doses. Okay, we've told all the providers that we're working with, and they're doing a great job on this. Your priority, if you have a waste dose, is 1A. Your second is 1B. And they should have their own list together. We do have a very fallback plan where we have individuals like medical reserve corps volunteers. We have law enforcement that are on a standby list, if you would, that again, that is a very fallback emergency list that we know that we can get them out. I'm not saying that's going to be the list now from today until, we're done with vaccinations. We're trying to figure out how many waste doses we have. How can we set up a system that best dovetails into the system that we have already to make sure that we can get as many people vaccinated who want to get vaccinated and not waste any doses.
Thank you.
Sure.
Hey, Eric, quick question from Caitlin with the Blade.
Yeah.
Should we be done vaccinating healthcare workers by now, or are you starting to see some who declined it the first time around now wanting to get it?
Okay, first question, kind of a little bit of a sticky situation there is that we think we have most of the 1A group done because we've offered multiple times to the 1A group. So that doesn't mean that we don't have individuals that are sitting out there that may not have signed up or like you just said, now, people are really not having an issue with the vaccine. So now I want to get vaccinated. We are going to make every attempt at the health department to make sure, again, those individuals are taking care of that 1A group because they are another vulnerable population that do help us every day that need to be vaccinated. But at some point in time, we need to say, okay, we've made the attempt. Nobody is coming to get their vaccine or nobody wants their vaccine. So now we need to move on. And again, it goes back to how do we shift those 1A doses to now the next phase, which is 1B. And so we could, again, behind the scenes, there's a lot of moving parts and we've got to make sure that we're utilizing the vaccine appropriately and how, the governor and ODH wants us to do.
And sorry, Eric, one more thing for me.
Sure.
You said, the first time around we got those 2,700 doses, but I haven't heard a new number of, consistently how many doses are we getting each week or expected to get?
Great question. Again, I think you've heard the governor, and we're going to stay stagnant. We might tick up a little bit with doses inside of the state, but we're receiving about 5,800 a week for all those providers that are on our website. So again, you can see it's not a lot, but that's probably going to stay constant now, and we'll report that out every week. If I don't report out, please ask. But again, about 5,800.
Thank you.
Sure.
Go ahead and ask your question, please.
Was that for me, Shannon?
Yes, my apologies.
It's okay. Sorry, I got cut off. I didn't want to cut in front of anyone. Follow-up question. You had mentioned the extreme wait list if they aren't available for the 1A or the 1B for those wasted doses. Yes. And you mentioned law enforcement. Mm-hmm. Obviously, that's not a part of the group, hasn't been announced in a group at all. Could you explain a little bit more how or why that's a backup plan, and if they would have that second dose available, once that comes around?
Again, that should be our fallback from 1A and 1B. So I want to make sure that the community understands that. The reasoning behind, again, law enforcement, again, please remember, law enforcement, unfortunately, has not been deemed to be able to receive that vaccine yet. The idea behind, again, some of the short list, this emergency list, is that we know that they want the vaccine. We can quickly contact them. They can get to a site quick, so we never have a wasted dose. And that's what we're worried about. Again, I want to make sure that the community understand that is a fallback list that we can immediately say, you are now able to get that vaccine because, again, you can get there within 15 minutes. And that's the important thing. I want to make sure the community understands this vaccine is fragile. And again, you've heard some of the horror stories out there about how they've been wasted. They sat too long on a counter, so many different things. And that is what we do not want to be known as a county who has wasted even one dose, if at all possible. Things are going to happen where we might have, you know, a mishap, but again, it just cannot happen. We have too many people that want the vaccine and need the vaccine.
A follow-up to that. So if they get that emergency, you know, the extreme fallback, like you mentioned, then
Yep.
Are they going to be, you know, guaranteed to get that second dose, or is it just kind of wait for another emergency?
No. So I don't want to get too much in the weeds here, but so you get the vaccination. We then put you into another state system. Again, these are a lot of the moving parts behind the scene that we have to do. We put you into Impact SIS, right? You also get a card that says when your next dose will be. And then that second dose is going to be available for you at that point in time. That's why it's so important when we say, listen, you need to be available 21 or 28 days, depending on which vaccine you get. So again, 21, 28 days, you have to be available to get that second dose. We've had conversations with individuals who want to go down to Florida, get their dose here, go down to Florida. Well, you know, again, those doses don't meet up. So again, that's a concern. There's a lot of logistics there. So again, get yourself vaccinated. Your second dose is going to be there, depending which vaccine you get, 21, 28 days.
Thank you so much.
Sure.
Melissa, go ahead and ask your question, please.
Yeah, thank you. I just wanted, so basically if people don't get, say I'm in the 75-year-old group and I don't get an appointment, you know, it continues to be booked. Is your advice to these people just check back daily, check back, you know, a couple times a day until something opens up?
Yes, that would be great advice to everybody. I think too, when we've had additional doses or we've shifted doses, we've notified the community that, again, something else has been opened up, and we'll continue to try to do that. Again, it's important to understand that this is very fluid. So doses can be maneuvered around if need be, or we might be able to have other doses that aren't used to be able then to open up another section or another scheduling session.
Okay, thank you.
Can I just make one point here, please, if you can? You know, we have that notification, that pre-registration that we rolled out several weeks ago. Again, that is even more helpful than we originally thought. I know it's double duty where you have to register and then you're going to have to register again for your vaccine, but that really helps us out a lot with planning, but also then too with notification. We're going to be able then to, as we go down different lists for different groups, we're going to be able then to send emails, hey, please sign up, or hey, listen, you know, we have another schedule of vaccines available. So it's really important that we constantly communicate with the community through multiple means, which includes you, but also then too through that notification pre-registration system.
Hey, Eric, Brian Duggar again.
Yeah.
Sorry.
No.
Hey, do you know whether anybody on the fallback list has actually received a vaccine at this point? And if any police officers have received it because they were on that fallback list?
I do know that, again, there's been a medical reserve corps volunteer, and I think 3 correctional officers as of, I do believe, yesterday that we had in the system, excuse me. I can get you a better idea of that as we go through the day. So I can get that to you.
Thank you.
Sure. Again, here's the thing about the waste doses. We want to make sure that we get those in arms as fast as we can. Again, you know, the system right now that we have in place may change as we understand better the vaccination process that we have now relative to the hospitals and those other entities.
Amy Steigerwald, go ahead.
Kind of not related to specifics, but when it comes to communication with United Way and the area office on aging, what are they telling you about how people are calling and their call volumes? We've been kind of talking with them a little bit, but just wondering how that communication is going for those who can't necessarily get it scheduled online.
Again, I can't say enough about United Way and area office on aging. They're experiencing high call volume, and there's a lot of work involved here. So matter of fact, I think every day we have a conversation with Area Office on Aging and United Way at some point in time, and we have discussions about these issues. So again, we're really trying to, unfortunately, do this on the fly. But I think United Way and Area Office on Aging are doing a fabulous job, again, of getting people that they can actually get into a seat to answer a phone call. I do understand too that, it's just not 80 and above for Area Office on Aging that are getting calls, which again, I think is okay. It really is some of these groups that are going to come online either next week or the next couple of weeks. So again, it's just not one age group that's calling both United Way and Area Office on Aging.
All right, Bree, go ahead and ask your question, please.
I didn't have my hand raised for another one. Sorry.
Okay, great. Sorry about that.
No.
All right. I think that concludes our press conference this morning. Thank you all for attending, and we will plan on doing this again next Thursday at 11 a.m.
Thank you, everybody.